These patients with diabetic foot infections need to be investigated thoroughly. We need to establish the cause of these ulcers. Essentially, there are three things which go wrong with these patients. Number one is that they lose the sensation or the power of sensation in their feet. When we say power of sensation, we mean that they stop feeling any pain or any discomfort in these wounds. This is a most unfortunate occurrence because pain is probably the most protective reflex which God has given us. If we don't feel pain, if you keep injuring a particular area and there is no pain, the wound will just keep increasing in size because you cannot feel the pain or the discomfort associated with it. So this situation, which is called neuropathy, which is extremely common in diabetes. And this is what leads to the increase in the ulcers and the worsening of the situation, without which these patients, and if this progresses without any treatment, these patients can actually eventually land up with amputations. So this is one problem. The other is a lack of blood supply. If there is lack of blood supply, which means that the arteries supplying blood to these areas are getting narrowed. अगर खून की नसों में थक्का जम रहा है और नसें सिकुड़ रही हैं तो खून नहीं पहुंचेगा, और अगर खून नहीं पहुंचेगा तो जख्म नहीं भरेगा। कोई भी जख्म अगर ब्लड नहीं पहुंचेगा तो जख्म भर नहीं सकता। इसलिए बहुत जरूरी है कि ये असेस किया जाए, पता लगाया जाए कि नस में खून जा रहा है कि नहीं। तीसरी चीज, the third thing that can actually affect this is presence of infection or underlying bone infection, osteomyelitis as it is called, infection of the bone. अगर जख्म के अंदर, जख्म के थ्रू हड्डी इन्वॉल्व हो गई है और वहां पे बहुत डीप सीटेड इन्फेक्शन हो चुका है, तो जब तक उस जख्म की सफाई नहीं होगी ये जख्म नहीं भर सकता। सो ये तीन कारण होते हैं। These are the three reasons why wounds do not heal, and we should look after them and make sure that the blood supply can be increased so that these wounds eventually heal up. How can we do that? How do we diagnose it? I will let you know.